Hello, I'm Daryl DeWald, Washington State University's Vice President for Health Sciences and Chancellor of the WSU Health Sciences Spokane campus. We're going to talk about research today in Health Sciences Update. Today we have an opportunity to have one of our prominent researchers here, and we're going to discuss a little bit of Dr. Ahmed's research. But before we begin, I wanted to mention that we do research as part of our mission. It's about challenges and real issues in society that we bring to bear researchers who look at those challenges and issues and they're looking for solutions. And this definitely is that type of situation. So Dr. Ahmed, if you would please tell us a little bit about yourself and also a little bit about your research.
Yeah, thank you so much for having me this morning. My name is Salah Ahmed. I'm here in a full professor in the Department of Pharmaceutical Sciences in the College of Pharmacy and Pharmaceutical Sciences. I think it's been really pleasure to be here and tell or share our research story and how this connects with the common people and the patients affected by it. So a little bit about my background. I did my PhD from India in pharmacology and toxicology. Then after completing my PhD, I decided to go into industry. But within a few months into industry, I found that I need to educate myself more on the topics that I really was eager to learn about and I was passionate to do research about. And at that time, when I'm talking about 25 years ago, the concept of inflammation was a very hot topic. People were talking about inflammation and the role of inflammation in different diseases. And I was really curious to understand the underlying mechanisms, how inflammation drives different diseases and so forth. So with that excitement, I accepted a postdoctoral opportunity in Case Western Reserve University in a division of rheumatic disease where the group was studying the role of, or understanding the role of pro-inflammatory proteins in causing chronic ailments or chronic inflammatory joint disorders. And especially they were focused on osteoarthritis. It's an age-related disease and it's bound to happen majority of aging population that are 65-year-old and above. So I think that was a wonderful opportunity for me. I spent a few years there understanding the molecular mechanism of this disease and so forth. And I was really passionate to move further. And then I joined as a faculty at the University of Michigan Ann Arbor, and where I switched my interest to rheumatoid arthritis because during studies that I was doing there at Case Western, I realized that rheumatoid arthritis is a more aggressive form of disease. There are different components that were talked about. Genetic component was involved, occupational, and some dietary patterns, that may result in onset of this disease. But actual reason for it and the underlying mechanisms that drive this and the contributing factors were really not well defined. So that really excited me to understand this disease and try to develop newer therapeutic options that could be more safer and more beneficial for the patient population. And I think so after that, we got multiple grants and eventually I transitioned into a more stable position at University of Toledo, College of Pharmacy and in the Department of Pharmacology, where I got the opportunity to explore ideas, and do things that I found very exciting. And eventually back in 2014, I got this opportunity to come here in WSU and join their mission of carrying, this healthcare initiative to combat chronic and inflammatory diseases.
So you have a very interesting international experience in terms of what brought you to where you are, what shaped your thinking and your interests. So you have a definite interest in inflammation, in osteoarthritis and rheumatoid arthritis. But if you can, give me a sense, kind of what is it that internally drives you to do this research? You've touched on this some, but how do you feel like your research is serving humanity?
So I think you really hit to the core. Actually, I've seen throughout my life a lot of people around who are affected by these rheumatic diseases. And if you look into the data, almost 1% of American population is affected by different rheumatic diseases, and perhaps it has been one of the major cause for work-related disabilities. People just give up their work because they just cannot work efficiently because of this disease. So it's very challenging on a daily basis, and patients live with this inflammation and disability and this disease and chronic pain throughout their life. And there has been some recent data that suggests that their lifespan is also reduced. And I've seen some people around in my personal and professional life, which have really inspired me to continue this work and find more effective and more targeted therapies for the treatment of this chronic diseases.
Outstanding. So you do really have a personal sense of the impact of these diseases on people's lives. So you're here at WSU, and it sounds like it's a good environment. You've been to some really excellent schools, and those universities also have research. But a couple questions, but what is it about WSU that seems like a good fit for you, Dr. Ahmed?
Yeah, so when I got this opportunity, and what I was looking for, something that will help me expand my research, that will help me bring more closer to the career objectives and the reality that we are chasing is like better therapies, more safer therapies, more affordable therapies. So I think I found that WSU had that promise and opportunity for me. So, and that motivated me to join our program here. And I'm blessed that in the last 5-6 years we have progressed so much. I think there are some groundbreaking discoveries that we have done. I will start with our landmark paper in 2016 after coming here, where we found that there is one of the key inhibitor of the protein that if you can switch that protein off, then you can really regulate a lot of inflammatory events that are going in the body of patients. And we have tried this in different animal models. And this laid foundation for a lot of upcoming research that we see now, where people have tried the same inhibitors for those proteins, and now they have been telling that this could be a really successful therapeutic target for the treatment of rheumatoid arthritis.
Excellent. Well, you represent one of the leaders in our research team in the College of Pharmacy and Pharmaceutical Sciences. It's a group that over the last 10 years or so has just flourished. And even if you just look at the growth of the research, it's grown by almost 20 times in the last 10 years. So we appreciate what you bring to bear, but what I see with that is there's some incredible basic research. So you do some what we would call cell signaling research and cell biology, but what you're doing is taking that basic research and trying to translate it to where you can devise therapeutic interventions. So if you can, give us a peek into the future of kind of your research program and what you're trying to achieve to translate those really important research findings that now might move toward therapeutic interventions to help those people.
Yeah, no, it's a very interesting question, and I think I'll start with this, by saying that we have heard about bench to bedside research, but I think I'll take a step forward in that terminology, where we are doing from bed to bench and then from bench to bedside research. And the reason for that is because whatever we are doing in culturing or in our labs is basically on the cells that we obtain from patients who are affected by this disease. So we get these tissues that are kind of really on a usual basis discarded by orthopedic surgeons when patients are going through synovectomies or hip or knee replacement surgeries, and we request them, these clinicians, to donate these tissues to us, and we harvest these cells from these tissues and understand why they are so aggressive, what are the things that they produce that causes the problems, and then understanding those reasons that drive the disease component, we try to, as a pharmacologist, try to design more targeted and effective therapies, which could be now translated to human population. So we are really trying to do from bedside to bench, and then again from bench to bedside kind of research.
I like that image. So you work specifically on what causes gout and the inflammation, and then you try to understand that more deeply. So if you can, just remind us what you've discovered in terms of like uric acid concentration. What's causing gout? And so tie together kind of the arthritis and what are patients and a lot of our population, what are they experiencing?
So gout is a kind of metabolic disease. When uric acid levels are to certain levels in the body, they are soluble form, they circulate in the body. But if they pass certain levels, then they start precipitating the body. And that's where they saturate in form of crystals. And these are the crystals that they usually affect or precipitate or deposit in the joints and cause flare-ups or inflammation. And once this happens on a constant basis, that results in bone destruction and deformities and eventually complete bone loss.
Okay.
So, and it's a very painful disease, and the basic cure so far is known as, well, you can just lower the uric acid levels. But I think we have reached to the next level, where we have found that one of the inflammatory proteins called interleukin-1 or IL-1 seems to be very central in causing a lot of inflammation or inflammatory signals that are triggering a lot of pain, a vicious cycle of pain. And what we have found in our research is there's one of the protein called TGF-beta activated kinase. That's it's abbreviated as TAC1.
Okay.
So what we found was if you inhibit that protein, you inhibit the production of interleukin-1 or IL-1 beta.
Okay.
So this is the kind of next step. And why we say next step in therapeutic targeting, because so far the therapies are, the researchers or scientists are looking at how you can inhibit IL-1 beta. Now we have gone even further, how you can really inhibit the production of IL-1 beta, not just the effects of IL-1 beta.
Okay.
So I think that's one of the leading reasons why we believe that TAC1 seems to be a very central player in not only regulating IL-1 production in gout, but it could be also applied to other diseases where interleukin-1 or IL-1 is a very major player. You talk about multiple sclerosis, you talk about type 1 diabetes, and other autoimmune diseases where IL-1 is very central to all these pathogenic mechanisms. So perhaps I think the application is even broader than what we anticipated.
So you've anticipated what I was going to ask. So if I'm understanding, the uric acid crystals, or a version of uric acid that precipitates, forms crystals, ultimately it leads to an inflammation that causes the pain and the bone destruction. And then you have identified a particular protein in this inflammation pathway, TAC1, that is a good potential target for therapeutic intervention. And it will block then this IL-1 inflammation process. And that works well to inhibit some of the negative consequences of gout, but it has broader implications. So if you could elaborate a little bit more, because this is even looking into the future of the research of what you're doing. You talked about some of the other disease states where inflammation is central to those processes. So if you can speak just a little bit more about that, please.
Yes, as I started by saying inflammation, because even if we talk about like a diseases like multiple sclerosis or type 1 diabetes, they are governed by inflammation. Multiple sclerosis or MS is basically inflammation in the brain. Type 1 diabetes is basically in an autoimmune disease where pancreatic beta cells are destroyed by IL-1 beta. So we're talking about the same vicious process, but also the same players that are playing the same role in different by affecting different organs that lead to different fatalities. So perhaps I think looking at a target that can really be a common target and could be exploited for further, therapeutic purposes is really kind of, groundbreaking, aspect of our research, and we're really excited about it, and potential opportunities exist in future as well in developing some therapies for TEC1 inhibition as well.
Okay, and if you could tell folks kind of what does your research team look like? Who's that made up of?
So I think everything that we do in the lab should be credit to those people that are involved. So I have a very kind of excellent or outstanding group of investigators. One of the lead authors in our last few studies has been Anil Singh, who's a research assistant professor working with me, and a team of my graduate students, very motivated, very passionate. And the reason I say that is because they are very much involved in local community, contributing to the awareness of what we are doing, what is being done at WSU. Recently, we were involved in the Arthritis Foundation event, Jingle Bell one, and everybody pitched in, and they were so motivated about this. So I really like to lead the team who is very motivated, who are not only good scientists, but they are also very passionate about what they are doing. And they're leading in different aspects and doing some really great things. So all these credit goes to those. I'm just a kind of mastermind behind things that we believe should be done, but I think these are the people who really do in the lab. So kudos.
Well, excellent, and I'm glad you appreciate them and the fact that they too are tying their scientific expertise to their commitment to humanity and really trying to help in this regard. So give us just a little bit of a peek into your future, and part of that can be you depend upon funding that comes from the state and federal sources, and as you look into your future, you say, well, we're probably going to be seeking funding and try to fulfill the mission of even different agencies. So who supports your work, and then what are you planning to do in the future?
I think so. We cannot do science without any funding support and constant support. So I'm really privileged and blessed to be well funded by National Institutes of Health, which is a federal agency. And I think I should also thank WSU for giving me a very competitive startup to make all these things that happen and support expansion of our research portfolio and plans, and also the core facilities that are supporting us in our research. And I think partly I will say that the future is where we are really going or leaping into drug discovery and development. I think that's been the major theme of our research. We just don't do science to understand what happens, but I think once we understand what's going wrong, and I think as a pharmacologist, we are really excited to see if we can really develop more safer, more beneficial, therapeutic in future. So I think that's a long-term planning. Consistent support is being tried and tested, and perhaps I think important thing is to really understand the need of the patients. At this point in time, the therapies that we have, they involve hospitalization, proper, there's kind of a socioeconomically challenging, a lot of upfront costs are involved and so forth. So we're trying to develop something that could be used as tablets, that could be a small molecule given orally and so forth, instead of infusions and hospitalization and all those things. So perhaps I think not only more effective or targeted therapies, but also more good for their pocket as well. So I think we need to really take into consideration on how this healthcare reform is taking place, how insurance coverages are kind of really declining and maneuvering, and a lot of challenges patient population come across this. I think one of the aspects that we need to really keep in mind as researchers, like how this could be really translatable. We can have great ideas, but are they really translatable to patient population? I think that's the core of our research.
Well, let me say to you, we are so pleased to have you at WSU. Your leadership, your commitment to serving, your commitment to discovering and developing interventions that will help people. So, Dr. Ahmed, thank you very much for joining us for Health Sciences Update.
Thank you for having me, Edward. It's really a pleasure to be here. Thanks.
Excellent.